Hi, everyone. I want to welcome you all to Pediatric Grand Rounds. I want to start with our land acknowledgement. We'd like to acknowledge the Ramaytu Shaloni people who are the traditional custodians of this land. We pay our respects to the Ramaytu Shaloni elders, past, present, and future, who call this place, the land that UCSF sits upon, their home. We're proud to continue their tradition of coming together and growing as a community. We thank the Ramaytu Shaloni community for their stewardship and support, and we look forward to strengthening our ties as we continue our relationship of mutual respect and understanding. And I'd like to invite our Vice Chair for Education, Dr. Sandrain Van Schaik, to introduce our speaker for today.
Hi, good afternoon, everybody. Let me start with apologies. Food is coming. So Jason, I'm so sorry. People might actually get into the back to get some food while you're starting to speak, but everybody will be very discreet and polite about it. Welcome everybody to Grand Rounds. It's a real great honor to introduce our speaker for today, Dr. Jason Nagata. You know, when I started organizing pediatric Grand Rounds, Grand Rounds was very traditional, as it is in many places, where you had to kind of sort of be a full professor to present Grand Rounds and had a full body of work to show. And our planning committee that we started had some earlier career people who said, well, what about all the young people who are doing really fantastic work, and why can't we showcase them? And I said, sure, why not? But then when I started reading some of the bios of the early career people that are sort of like a few years into their career, I'm like, oh, they actually have done more than most full professors that presented previously. And Dr. Jason Nagata is absolutely one of those people. And then we're going to read his bio and you realize what I'm talking about. So he's an associate professor of pediatrics in the Division of Adolescent and Young Adult Medicine at the University of California, San Francisco. He's really focused his career on adolescent eating disorders and first began researching social media use through its impact on body image and eating disorders. He has published over 300 articles in academic journals such as JAMA and The Lancet, and his research has been covered by national media, including the New York Times, NBC News, NPR, and CNN. He co-founded the International Association for Adolescent Health Young Professionals Network and is a commissioner for the Lancet Commission on Adolescent Health. He's the recipient of the American Academy of Pediatrics Emerging Leader in Adolescent Health Award, the International Association for Adolescent Health Young Professionals Prize, and the Grumbuck Award for research. And he reminded us last week, 2 weeks ago during a research day, that actually is only a few years ago that he gave the Grumbuck lecture. And during that time, he actually was also honored with a fellowship leadership and advocacy group mentoring award. And in the audience today, to just show how much mentoring he does, he has a whole group of graduate students who are doing a summer internship with him. And I've just sort of seen him through the glass wall of the room where they're gathering. And it's like clearly what an engaging mentor he is. And I'm just really excited that he accepted the invitation to give us an update about the work that he's doing. Dr. Nagata.
Thank you so much for having me. And yeah, I'm really excited to talk today about the impact of screens and social media on adolescent health. And I thought that I would start with a case. As many of you know, I work here at Benioff Children's Hospital in the inpatient adolescent and young adult medicine eating disorders service. And I first became interested in research on social media through patient care and research on adolescent eating disorders. During the pandemic, several of our adolescents with eating disorders had noted that while stuck at home, they spent countless hours browsing social media sites where many of them became lost in disordered eating content related to weight loss or muscle building. And concurrently, during the pandemic, hospitalizations for eating disorders doubled here at Benioff Children's Hospital and also nationally. And I recall that several of our patients, while hospitalized, would actually use social media to find and share tips on how to continue disordered eating behaviors in the hospital, despite the severe medical complications of their eating disorder. And it was just apparent to me that this was a big issue that needed more attention. Around the same time in 2021, Frances Haugen, who's also known as the Facebook whistleblower, released thousands of Facebook's internal documents to the Wall Street Journal and the Securities and Exchange Commission, which led to high-profile testimonies in Congress and national media coverage, especially on the impacts of social media on girls' body image and eating disorders. And so here are just some examples of that initial Wall Street Journal article and the New York Times coverage. And in general, what we do know is that in terms of linkages between social media and eating disorders, some of the thoughts are that having these constant comparisons to unattainable body ideals and the use of filtering, editing, curation, and selection bias, which is taking thousands or hundreds of photos and only choosing the one or two that are the most sort of glamorous. And then also this pressure on social media to not only consume content, but actually to display or post content of one's own bodies in order to gain likes and followers. And then, as I had mentioned with some of our patients, actually just direct exposure to eating disorder content are all potential pathways from social media to eating disorders. And in terms of psychological theory, the tripartite influence model is one of the models that we think about in terms of the three big factors that can lead to eating disorders, which are media, parents or families, and peers. And social media somewhat uniquely kind of merges these. It merges the media with peers and to some extent families. If families are also on social media, that can lead to more internalization of body ideals and comparisons with others in terms of appearance that can lead to body dissatisfaction and disordered eating. Now, some of you may know that a lot of my research is actually focused on eating disorders in diverse populations and diverse genders, including boys and men. And so actually right after the Facebook whistleblower files were released and the Wall Street Journal had all its coverage on social media and girls' body image, I actually wrote a op-ed in the San Francisco Chronicle documenting what we know about social media and boys' body image, because there are some studies that have started to show some of the impacts. And actually, boys are more likely than girls to allow for public followings on social media. Male selfies are more likely to be full body photos that show muscles as opposed to just their face. And a majority of male body image related Instagram posts have depicted muscularity and leanness. And studies in terms of consumption of social media have found that Instagram use in boys and men is associated with meal skipping, disordered eating, muscle dissatisfaction, and use of anabolic steroids. And so even though the predominant narrative in the media was really focused on girls, I just wanted to remind people that eating disorders can affect boys as well, and that there may be unique considerations. And so actually, as a follow-up, the Wall Street Journal did actually do coverage and the analysis of how social media may impact boys and eating disorders, and included some of our work and interviewed me for that. So that was all the sort of the background that really got piqued my interest into research on social media and adolescent health. And so as an overview of today's presentation, I will just talk a little bit about more background. And I will primarily be presenting research from the Adolescent Brain Cognitive Development Study, or the ABCD study, which is a national prospective cohort study that is contemporary, that has a lot of social media and screen use measures. First, I'll talk about screen use trends over the last several years, and then linkages between screen use and mental health, what we've found out from the ABCD study, then screen use and physical health. And then finally, I'll talk about some recommendations and guidance for clinical practice. So in terms of methods, most of the studies that I will be referring to today come from the Adolescent Brain Cognitive Development Study. It's the largest long-term study of brain development and child health in the United States. It started in 2016 to 2018 from 21 study sites across the US, with a sample at baseline of nearly 13,000 adolescents. And it has measures of screen use, mental health, and physical health, and many others. This is just a map of the 21 different study sites across the US. And I'll just note that in Northern California, our site is SRI International. And we actually have our SRI site PI, Fiona Baker, here with us, joining us, and Orsilia Kiss. And then there are also 3 Southern California sites at UCLA, USC, and UC San Diego. The ABCD study is actually a very rich data repository for screen use measures because they collect a lot of screen use information. So they actually ask adolescents about the report of screen use. So there's a screen time survey for the adolescents. They actually ask specifically about screen use at bedtime, so what they're doing right at bedtime, cyberbullying, and problematic screen use, so elements of addiction for different modalities, including social media, video games, and mobile phone use. In addition to the youth surveys, they do ask parents about screen use. So they also have the parent report of screen time, and also some questions about parent monitoring and parent rules and guidance for their children. And then finally, there is actually a objective mobile phone app called EARS, which stands for effortless assessment of risk states, that actually now is passively scraping mobile phone data from the adolescents who have smartphones. So as I mentioned, the ABCD study is a contemporary study. It's actually still ongoing. When it started, all of the participants were 9 to 10 years old, so right at the beginning of adolescence or slightly before. And then there's annual data collection. As you can see, more measures have been added as the cohort has advanced. And so it does allow us to have some more longitudinal studies. And I will just note that most of the studies that I'll be talking about today really focus on data from this period. So it's really early adolescence, 9 through 14 years old, which is, I think, a really important time to focus on, because this is often when kids first started getting access to mobile phones or start social media accounts. And so it's sort of when they are first beginning to engage with screens and engage in screen behaviors. So first, I wanted to talk about some screen use and social media trends that we found from the ABCD study. From the baseline sample, so again, 9 to 10 years old, the average screen time that was reported was about 4 hours per day by the adolescents. And there were some notable differences by demographics and socioeconomic factors. So Black adolescents had reported about 5 hours per day, whereas Asian and white were less, about 3 hours per day. Boys reported about 45 more minutes of overall screen time, which was largely driven by video game usage. And then those from lower income or with lower parental education, that was associated with higher screen time. What was not, predicted from the start of the ABCD study was that the pandemic would happen. And so the study, certainly continued capturing data on screen use trends through the pandemic. And so I think one really notable finding was that early on in the pandemic, so in May 2020, actually screen use doubled in adolescents to almost 8 hours a day. And I will note that this is recreational screen use, so this does not count any Zoom school. Many schools were online, but participants did not include that in their estimates. So many of them actually were getting much more than 8 hours of screen exposure per day. And this was largely driven by streaming videos or watching television, as well as video games. I think one thing also to note is that technically, the minimum age requirements for social media accounts are 13 years old. And so all of these participants at baseline in the first few years are actually under 13, which means that they had to lie about their age to get access to an account. And even at baseline, over 20% had access or reported having a social media account. These are just a graphic of the general trends from 2017 to 2021. And so as you can see, there was a rise even prior to the start of the pandemic, kind of peaked into the pandemic, and we're continuing to look at data trends beyond. But it does seem like, understandably, during periods of lockdowns and early in the pandemic, there was a rapid rise. And now that things have started to reopen and schools are back in person, that has started to decline. The finding that screen time had doubled during the pandemic, I think, was very notable for national media outlets. So actually UCSF did a press release on that and got lots of coverage. And actually one thing that I think is notable is the Surgeon General in 2021 actually issued an advisory on youth mental health amidst the youth mental health crisis. And within that advisory, there was a section on screen time and social media use. And they cited our studies from ABCD showing the rapid increase in social media, especially during the pandemic. Now, in the field, there is, while screen time is an important metric, it's not the only metric. And I think that people are noting that while time is one factor, there are other factors like content and context and specific interactions that happen on social media that maybe time doesn't capture. For instance, if you're watching an hour of an educational video or say Grand Rounds, that may not have the same effect as an hour of cyberbullying or violent video game content or something else. So like not all time is necessarily equal, and so there has in the field been some recognition of an idea of maybe problematic social media use or even social media addiction. It's not formally recognized in the DSM yet, but the ICD-11 does have two disorders related to addictive screen behaviors. One is gambling disorder and gaming disorder, each of which can have the internet as a diagnostic specifier. And these may be characterized by an inability to stop, neglecting of other important areas of life, withdrawal symptoms, and changes in typical behaviors, affects, and hygiene. And so the ABCD study did start to include a social media addiction questionnaire, which has these questions here, and a similar one for video games and mobile phone use. And this was started in the second year, so when they were 11 to 12 years old. And just some notable findings from these problematic screen use questionnaires in terms of mobile phone use. Among those who had mobile phones, almost half said that they lost track of how much time they are using their phone. 31% said they interrupted whatever else they're doing when they're on their phone. 11% said the thought of being without my phone makes me feel distressed. In terms of the social media addiction questionnaire, among those who had social media accounts, 22% said that they spend a lot of time thinking about social media or planning use of social media apps. 20% said they use social media apps to forget about their problems. And 16% said they tried to use social media app or tried to use less, but they weren't able to. And then for video games, among those who played video games, 41% said they spend a lot of time thinking about video games. 21% said they feel the need to play video games more and more. And 24% say they play video games so they can forget about their problems. In terms of demographic differences in problematic use, boys reported higher problematic video game usage, whereas girls reported higher problematic social media and mobile phone usage. And then Native American, Black, and Latinx adolescents reported higher problematic screen use measures across all of the modalities compared to non-Latinx white adolescents. We also had some very notable findings by sexual orientation. So actually, sexual minority adolescents, so those who identified as gay, lesbian, bisexual, actually reported almost 4 more hours per day of screen use than heterosexual peers, and also higher problematic screen use. And gender minority adolescents, so those who identify as transgender or are questioning their gender, had 4.5 more hours of total screen use than their cisgender adolescents. And also, and even those who were questioning their gender, so they weren't sure if they were transgender or not, also had more use than those who reported they were cisgender. The cyberbullying questionnaire was also asked. So among these 11 to 12-year-olds, almost 10% had said they had experienced cyberbullying victimization, and sexual minorities had almost 3 times higher odds of being a victim of bullying than their heterosexual counterparts. Boys reported higher perpetration, but lower victimization of cyberbullying than girls. Also, this study just came out last week, but they actually did ask an online dating question among the 11 to 12-year-olds, and actually 0.4% reported they had engaged in an online dating app. Now, most online dating apps require a minimum age of 18 to engage, and so these 11-year-olds mostly also were probably not truthful about their age when they started, and males had a 3 times higher odds of online dating, and sexual minority adolescents had 13 higher times odds of online dating. So yeah, these are just sort of some general trends among early adolescents across various media usage from the ABCD study in the first few years. Now I'm going to talk a little bit about some studies looking at screen use and mental health. First, I'll be talking about eating disorders, and then I will talk about other mental health outcomes. This is just sort of a conceptual framework of how social media and screen use may lead to binge eating, potentially through different mechanisms. And so the first study that we actually looked at was looking at binge eating disorder, because actually, even though binge eating disorder doesn't get as much recognition as anorexia nervosa and bulimia nervosa, it actually is the most common eating disorder in adolescents and adults. And so even among these 10 to 11 years old in the first year of follow-up in the ABCD study, this was the eating disorder that had the highest prevalence. And overall, we found one of the, I guess, advantages of the ABCD study is that we do have prospective data. And so we were able to look at social media exposure at, one time point, and then look at new onset eating disorders, new onset mental illness, and subsequent years, 1, 2, 3 years later. So most of these studies that I'll be reporting now are prospective analyses that show, initial exposure and then new onset outcome. And so with binge eating disorder, every hour of social media use that the 9 to 10-year-old reported was associated with 62% higher odds of binge eating disorder. So meeting the criteria, the DSM criteria for disorder, not just binge eating like as a behavior. 1 year later, texting, watching TV were also associated prospectively with binge eating disorder, as well as total screen time. I had mentioned previously that we were trying to understand also what could explain the relationship between screen time and binge eating disorder. And Abu Bakr al-Shwabi, who's here, did a mediation analysis showing that screen time leading to depression was partially mediated the association between binge eating disorder. So there is high comorbidity between depression and eating disorders. And at least in this analysis, we were able to show that screen time led 1 year later to depression, and that could explain some of the relationship to binge eating disorder 2 years after that. Other symptoms that link screen time with and social media time with other eating disorder symptoms, not just binge eating disorder, were that screen time and social media use were associated with greater fear of obesity, self-worth tied to weight, compensatory behaviors to prevent weight, and binge eating and distress with binge eating 2 years later. And these are more like symptom characteristics rather than a diagnosis, but can also explain some of the things that screen and social media exposure may lead to later on. One other potential mechanism that could explain the linkage between social media or screen use and eating disorders is cyberbullying. We do know actually that in-person bullying, previously before screens were available, was associated as a risk factor for development of eating disorders. And we similarly found that cyberbullying, so online bullying, was also associated with more eating disorder symptoms, including some of the ones that I had mentioned before in the ABCD study. And actually, interestingly, also with more perpetration of cyberbullying as well. I will now talk about many other mental health outcomes, even though our initial analyses were focused on eating disorders. And as I had mentioned previously, I think one of the gaps in prior literature, since this is a relatively new field, is that most previous studies have been cross-sectional, which means that all the screen time and the mental health outcome data are collected at the same time point. So you're stuck with a little chicken and the egg. You don't know which one caused what, and you can't really tell directionality. And so our goal in these analyses were really to do prospective analyses where we could at least control the time ordering where the screen exposure occurred prior to the onsets of the mental health outcome. And for these next analyses, I'll show first the exposure of screen time, so like time or hours per day. Then I'll look at problematic screen use, so the social media addiction questionnaires, and then finally cyberbullying as potential risk factors or exposures for mental health outcomes. And starting with depression and anxiety, some of the most common mental health symptoms or outcomes, similar pathways that could explain linkages between social media and depression and anxiety could be through cyberbullying or discrimination, stress, social isolation, and sleep. So first we looked at prospective associations between screen time. So again, this is hours per day, and a variety of mental health outcomes. And I think what you can see here is that they're all significant, but the effect sizes are pretty small. This was measured from the Child Behavior Checklist, which is a symptom scale that ranges from 0 to 100. And so these are in the magnitude of 0.0 something. So they are statistically significant, but relatively small effects in subsequent years. Although I will note that this is per hour of exposure per year. So, if someone has 8 hours, which was the average in the pandemic, that could add up. And then over several years exposure, these small effects could potentially accumulate. We also found linkages between actually suicidal behaviors 1 or 2 years later, particularly with texting, video chat, and social networking or social media. Again, relatively small effect sizes. We also found linkages between screen time and obsessive compulsive disorder 2 years later. And the two modalities that were associated were videos, like YouTube videos, as opposed to television videos, and video games. And I think one thing to note that was interesting is that, thinking about why video games in particular might lead to obsessive compulsive disorder or a higher risk for that, could be that, there's a lot of aggressive or stressful intrusions that could occur during video games that could lead to obsessions. There are reports that there are many rituals that promote perfectionism in video games that could lead to compulsions, or going through certain levels and certain rules. And then also just excessive engagements can lead to compulsivity and loss of behavioral control. And then in terms of the YouTube videos, one thing that was very interesting was that there was not a significant linkage between traditional television viewing and OCD, but there was between YouTube video watching and OCD. And part of the thought process for that is that YouTube, uses algorithms. And so if you are stuck in one type of content, and I'll just use eating disorders for an example, if you search for something, YouTube will then feed you back very, very similar content. And, there's billions of videos that you can watch. And so it can really promote compulsive viewing, even if somebody is not trying to. Whereas if you think about traditional television, like not even Netflix streaming, but, if there's a show that's on at 8 p.m. on a Saturday, you have to wait another week to watch the next episode. And so it really is harder to compulsively view in that way. Of course, many people now stream over traditional television viewing, but that was just sort of an interesting sort of new exposure. We also looked at disruptive behavior disorders, so conduct and oppositional defiant disorder, and found that specifically social media, social networking was linked with conduct disorder, a little bit of a larger effect size, but still moderate. And then for oppositional defiant disorder, television, video games, texting, and video chat, as well as total screen use. Some of the mechanisms that could explain this would be that there could be exposure to harmful behaviors. Also, lots of social media interactions can be anonymized, which can allow for hateful posting or cyberbullying without as many consequences as perhaps in-person bullying. And so, online hateful activity, I think, has perhaps fewer repercussions, especially if you have an anonymous account, than maybe in-person hateful interactions or bullying. And then also, there's the displacement hypothesis, which is just in general, the more time that you spend on screens, that, by definition, you're not asleep, and you're generally not being physically active. And sleep is obviously so important for all these mental health outcomes, including the disruptive behavior disorders. And so if you're sleep deprived, you're more likely to act out or have disruptive behaviors, and also potentially have less attention that could lead to more argumentative or defiant symptoms. So those studies that I've mentioned up till now have all been about screen time. So again, hours per day. And I would say overall with weak effect sizes. So many of them were significant, but it's certainly not deterministic. Now, when we look at problematic screen use, so again, these questions that get to more like addictions or some of the behaviors that could be problematic, you'll notice that there are still significant associations, but the effect sizes are a little bit bigger, even like 10 times magnitude. The previous ones were like 0.0 something, these are 0.1 something or 0.2 something. So it does seem like, if there are aspects of problematic use, that could be a bigger risk factor for some of these mental health behaviors or outcomes. And so in terms of looking at the same, depression, anxiety, somatic problems, attention deficit, oppositional defiant conduct. In general, there were some prospective associations with phone use and social media problematic use, a few less with video game use. And then we also looked at substance use behaviors or substance initiation of alcohol, tobacco, and marijuana. And actually, those also had a little bit higher effect sizes, particularly for phone use and social media use, less so for video games, and then also suicide and sleep disturbance. Finally, we looked at cyberbullying specifically, so the experience of being a victim of cyberbullying. And again, these are also higher effect sizes, larger effect sizes than the screen time. So it does seem to indicate that if you are bullied as a result or online, that maybe a specific risk factor for particularly depression, somatic problems, or attention deficit problems with magnitudes larger than screen time and maybe comparable or even higher than problematic use. And also a little bit larger effects with cyberbullying and substance use initiation than with screen time just alone. So that's just a summary of what we've known so far in the first few years of some prospective analyses on screen use and mental health. I also wanted to look at some physical health outcomes and note that these are a little bit arbitrarily defined, separated. Obviously, many of physical health and mental health go hand in hand, but I will just talk here about sleep and cardiovascular disease as well. And so I had mentioned earlier that there's actually a very specific questionnaire about bedtime screen behaviors in the ABCD study. And so based on this, among the 11 to 12-year-olds, almost 2/3, so 63%, said that they did have an electronic device in their bedroom when they went to sleep. And 17% said that they were woken up by notifications sometime in the past week. And both having a bed in their or a device in their bedroom and being woken up was associated with greater trouble falling or staying asleep, and also overall sleep disturbance as measured by the sleep disturbance scale reported by their parents. There are a large number of screen use behaviors that were asked about, including having a screen in the bedroom, leaving the ringer or notifications on, and then receiving phone calls, text messages, or emails, various modalities, and all of these use at bedtime were associated with trouble falling or staying asleep, and also overall sleep disturbance. And this analysis was cross-sectional, but we have now done the one-year follow-up analysis, and findings are similar, but a little bit weaker. But overall, I do think that bedtime screen use is a very important exposure, particularly related to sleep. Next, we looked at some BMI and weight-related outcomes. And so every hour of screen use was associated with a higher BMI percentile 1 year later. Again, these are small effects, like 0.22 higher percentile. But again, if you think about this is per hour of screen use, so if the average is 4 hours, or during the pandemic, the average was 8 hours, that does add up. And that's also for every year. So if you have multiple years of screen exposure, these, in 10 years, you would gain 10 BMI percentiles, which actually can be a big difference. And so some of the mechanisms that potentially could lead from screen use to higher BMI or weight gain. In general, people are distracted in front of a screen, so you may be more likely to overeat or snack, even in the absence of hunger. There are studies that have shown that even people without satiety cues will, if they're just bored and distracted in front of screens, they'll just continue to eat even if they don't feel hungry. There may be many food advertisements that they're exposed to. And then in general, people, while they're watching screens, are sedentary or sitting, and so that can displace physical activity. One other gap in the current actually physical activity guidelines are that currently the AAP and the Department of Health and Human Services recommends that for adolescents, they should get 60 minutes of moderate to vigorous physical activity a day or more. But given that the screen exposure or sedentary time is so large these days, there have been some questions as to if people are very sedentary throughout the day, if actually there are higher recommendations needed for physical activity. So for instance, if you're sitting for like 10 hours a day, you actually need more physical activity to offset that sitting time. And this is actually the same dilemma in adults. Like people who are active during the day perhaps have some benefit from not being sedentary versus people who are sitting in an office from 9 to 5 and mostly sedentary. And so we were trying to look at, especially at combinations of screens and steps. The ABCD study does have a Fitbit collection, and so they actually can objectively measure the step count of participants. And so we made 3 screen time categories based on sort of the distribution. So the highest category was greater than 8 hours, the medium was 4 to 8, and the low was 0 to 4. 12,000 steps per day approximates 60 minutes of moderate to vigorous physical activity. So that's approximately the guideline. 6,000 is approximately half the guideline, so like 30 minutes, and then less than that. And then we looked at BMI percentile, or obesity risk. And I think one thing that was interesting from this is that if you look at the low screen use category, having more steps is beneficial overall. Let's see if I can, and then same with the medium step category. But if you get into the high screen time, so if you're having more than 8 hours of screen time a day, it actually doesn't seem to matter how many steps you have. It doesn't seem to offset your obesity risk, which is to say, if you're really sedentary or in front of screens for a long period of time, at least the current physical activity guidelines do not protect you from obesity risk. I think one other important thing to note, as mostly pediatricians here, is that we talk about, we give anticipatory guidance and advise our adolescent patients and their parents, but we actually often don't see the fruits of our labor in terms of anticipatory guidance, because some of the outcomes like cardiovascular disease risk, heart attacks, hypertension may not happen until they're adults. These behaviors that they're doing now in adolescence, they may not actually become medical conditions, until decades later. And so the ABCD study is great because we have a lot of contemporary screen use data, but I'm now going to go in a blast to the past and look at cohorts that actually started in the 1990s and 1980s to now look at what mostly television viewing exposure back then happened, or how that results in cardiovascular disease, decades later. So this first study is looking at the National Longitudinal Study of Adolescent to Adult Health, called AdHealth. This was measuring teenagers in the 1990s. I think baseline was 1994. And then now we have 24-year follow-up data. And at that point, the average screen time was about 2.86 hours per day. And every additional hour of screen use 24 years later was associated with higher odds of diabetes, higher odds of high waist circumference, and an increase in BMI 24 years later. And then if we even go back further to the Cardia study, which started in 1985, 86, with young adults who are now in their 60s. So we have over 30 years of follow-up. We similarly found that young adult screen time, mostly television time, was associated with higher risk of obesity, hypertension, diabetes, and dyslipidemia. And actually the cohort is now old enough, unfortunately, that they have started to have cardiovascular disease events like heart attacks and strokes. And screen use in young adulthood is now, we've shown, is prospectively associated with higher risk of heart attacks and strokes 30 plus years later. So I think it is just important to note that, especially through sedentary behaviors, there may be outcomes that we as pediatricians will never see, but that can affect people's, much later in their life. Back to the ABCD study and more contemporary data, some of the explanations for weight gain and some of these cardiovascular disease risk outcomes could be through nutrition. I had mentioned that people are exposed generally to food advertisements. And so the ABCD study actually had a MIND diet measure. The MIND diet is the Mediterranean DASH diet. So in general, it's like a cardioprotective and cognitive protective diet. It's like a healthy diet. And in general, more screen time was associated with lower adherence to the MIND diet, both prospectively and cross-sectionally. Again, relatively weak effect sizes. This is just a schematic specifically on social media and total screen time. So the more hours of social media or screen time you had per day, the lower your adherence was to the MIND diet. And so this is just sort of a summary of, in terms of physical health outcomes, sleep, weight, nutrition, and cardiovascular disease risk. Now, up until now, I've talked about, kind of bad health outcomes. And I just wanted to note that screens in themselves are not inherently get bad or good. There are some risks, there are some benefits. And so I just wanted to note some potential benefits of screen use because it is ubiquitous. Everybody uses them. They're not going away. And so to some extent, recommending like completely abstaining from screen use is likely impossible for most adolescents. And so, even though social media gets a bad rap, the initial intention was really to promote socialization, social support, and connection. And so when used properly or in certain ways, it can do that. And I think one example of this is actually in sexual and gender minority adolescents. There are, studies that have shown that, particularly in minority groups, you could imagine, a gay or lesbian adolescent in a rural community where, in their middle school or high school, they may be the only person out, but they can, reach a much broader support network online, through social media or, certain online platforms. And so there are many ways, particularly for minority adolescents, to connect with people that, may not be available to them in their local community, to get this support and connection. And so I think that's just one important thing to note. And then in terms of physical activity, even though for the most part, screen use displaces physical activity, it doesn't necessarily have to be that way. And so there are, certain interventions now that are being developed, like exergaming, which is like incorporating exercise into video game use so that while you're playing, you're like being active. And, you can, take online classes. During pandemic, PE classes were virtual. And so there are ways to promote physical activity while you're on screens. And I will also just note there are educational opportunities from screen use. Those of you who are watching this on Zoom right now, there are opportunities that you might have otherwise missed. And one actually interesting finding that we found from the ABCD study was that, as I mentioned, because it was during the pandemic and it captured some actual pandemic behaviors, we actually found that the adolescents 12 to 14 years old who used more social media and more television media, actually this was associated with higher adherence to masking behaviors in this group. So there were perhaps more public health messages that they saw. And so that's just kind of one interesting finding that we found during the pandemic. So just a summary of some of these studies so far, we've tried to focus on prospective associations rather than cross-sectional to get to time ordering. In general, the studies on screen time and mental health have had small effect sizes. When we get to problematic use, the effect sizes are a little bit larger. So there is something about this addiction quality that may have an effect, and also cyberbullying. So I do think that content matters. And if you're asking your patients, you might specifically ask about cyberbullying or disordered eating content, because I do think that there are certain types of content that could be triggering or lead to mental health symptoms. And then also just the sort of displacement hypothesis, which is that especially for the physical health outcomes in general, thinking about when adolescents are on screens for 8 hours a day, even if that itself doesn't have an effect, just it displacing other things, like not being physically active, not being in person with other people. It's like, what could they be doing during that time that they're not doing because they're in front of their screen? So in the last part of this presentation, I'm just going to briefly go through some of the current guidance from professional societies for parents and adolescents. And there's actually been a lot of movement in this area in the last few years. So first, I'm going to start with the American Academy of Pediatrics. There are media use guidelines. The most recent ones were from 2016, actually. And there's a little bit of more nuance in the younger age group, 0 to 5. But since we're focusing, and they're up here, but since we're focusing mostly on adolescents, I did want to note that actually the recommendation is the same for 5 to 18-year-olds. And I do think that that is an area that we can improve on, because obviously screen rules that you might have for a 5-year-old could be very different than what you would have for an 18-year-old. Previously, the recommendation was less than 2 hours a day of recreational screen time, but in 2016, that was actually eliminated because nobody was following that. And now the recommendation is a family media use plan. So there's no magic number that they'd say, but in general, it's just you should have a discussion with your family to make an individualized plan. And some of the components could be screen-free times. So, maybe at bedtime, around family meals. consider screen-free zones, especially for younger kids. If you don't want them getting into bad content, then maybe forcing them to use screens in public spaces so you can monitor a little bit better, and restricting use in bathrooms and bedrooms. And then, talking about balance, the pros and cons, and also privacy and safety. I had mentioned earlier that the ABCD study actually does ask about parent media practices. And I'll just briefly note, we have a paper coming out next week that shows that in general, and these generally mirror the AAP family media use plan, but in general, modeling screen use, so like parents modeling their own screen use, the more parents use screen use, the more their child will use screens that have more problematic use. The more mealtime or bedtime screen use that's allowed in the household, the more problematic use will be with the adolescent. Parent monitoring was associated with lower problematic use. Restriction of screen use was also associated with lower problematic use across the different modalities. So again, not surprising, but I will say that this was really focused on early adolescents, like 12, 13-year-olds. And so I do think that there is room for more nuanced guidance, because I do think that with like an 18-year-old, some of these may backfire. And so you do have to think about developmental stage. But especially earlier on in adolescence and for younger kids, I do think that rules can be helpful. The American Psychological Association last year actually put out the first set of social media specific recommendations. I won't go through them all in detail, but there are 10 points. So one, just promoting use that encourages socialization. Second, using selected social media sites that could be tailored to children, and they're making sure they're developmentally appropriate. 3, especially in this early adolescent group, to start coaching or talking about safe use even before you allow them to have an account. So there's like sort of anticipatory guidance. 4, really trying to limit access to harmful material like illegal activities, self-harm, eating disorders. 5, limiting access to hateful content like discriminatory accounts. 6, screening for harmful social media use. This could be like problematic use. 7, trying to limit social media use that prevents sleep and physical activity, so those that displace these behaviors. 8, limiting social comparison, especially with beauty and appearance. 9, before they reach the age that they're on social media, trying to train them or talk to your child about it. And then 10, just more research. So I had mentioned that in 2021, during the pandemic, the Surgeon General issued a general advisory on the youth mental health crisis. In 2023, last year, there was a specific advisory on social media and youth mental health. And this also had some summary of what parents and caregivers can do. It kind of reiterated the family media use plan from the AAP, having screen-free zones, reporting cyberbullying, teaching kids about technology, and modeling responsible behavior. One other thing that I think is useful is working with other parents in your child's friend group for shared practices. So one example of this is if you, as a parent, are the only one in your friend group who restricts social media, it's not going to go well, right? Because everyone else, all their peers are going to do that. But if you can get together with all the parents of your friends and say, we're all going to say these are the rules for all the kids in your group, they're more likely to be able to adhere to that because the rules apply to the whole sort of social network. And then in terms of what children and adolescents can do, reach out for help if there are any of these red flags, create boundaries, have some protective strategies, be very cautious about what people are sharing, and don't keep harassment or abuse a secret, and conversely, don't take part in online harassment or abuse. The Surgeon General also did not let tech companies off the hook. There's obviously, we as pediatricians can say whatever we want, but ultimately, I do think that some of the most effective interventions are designed within the apps themselves. And so I do think that, many of these companies are not financially incentivized to do this, but I do think that there's lots of hearings right now in Congress that are considering mandates for these just because of these potential, and also all the data right now is, the research that we do in ABCD is what some of the best that we have in terms of reporting, but it's very small actually compared to the data that the social media companies themselves have. And if we actually could use that for research, I think that there's a lot more that we could learn. And then finally, in terms of policymakers, I had sort of mentioned there's actually lots of federal and state bills right now on social media use and restrictions, and there's almost too many to keep track of, but many of you may have heard of like the recent TikTok ban federally. But just a few things that I will note is in 2023, the Children and Media Research Advancement Act was signed by Biden. It was a bipartisan legislation that directed NIH to launch a research program on the media effects of children and adolescents. And so NIH now has money earmarked for that. And with Fiona and Orsi here, we did put in a grant and got the first round of funding from that for our first R01. And then a month ago, they actually, as part of this act, held a workshop that sort of summarized the evidence that we know up till this date on the impact of technology and digital media use. And I went over there and presented our ABCD study work. And again, this is part of the Camera Act. And some things to, I think, note: federally, nothing has been passed in terms of social media bans, but individual states actually have. And Utah actually was the first state to pass the Utah Social Media Regulation Act, which actually requires age verification, requires parental consent for any minors under 18 to open or maintain a social media account. And it also requires social media companies to provide parents with access to content and interactions of their minors. And so this is supposed to be implemented this year. There are several other states that have similar bills, and it will be interesting to see how that plays out. Unsurprisingly, the social media companies are suing, and there's some litigation related to this. But I think as more of these pass, actually there will be more onus on parents to have to make decisions about, that will actually require children to get their parents' consent if they want a social media account. So just a few key points. Screen use in social media is not inherently good or bad. There are risks, there are benefits, and I think the goal is to just try to minimize the risks and harms while optimizing the benefits. I think it's really important to consider developmental stage. As I mentioned, an early adolescent may benefit from different rules than an 18-year-old, and ultimately you are trying to develop skills for your child so that when they become 18 or young adults and become adults, they have good skills and behaviors that they can use for the rest of their life. And I will say that this talk has focused on adolescents, but I think all of us are faced with these same dilemmas, and all of us have constant exposure to screens and media in some regard. And so I think a lot of focus is on children, but I think we should look at ourselves and also be good role models for our children, because as we saw, one of the biggest predictors of child screen use is actually their parents' screen use. And one thing that some people have suggested is for the displacement hypothesis to just, in the back of your mind, if you've been on the screen for maybe a while, just ask yourself, what else could I be doing? And if you're enjoying whatever you're watching, fine, you can continue. But if you're I've been doom scrolling for the last 30 minutes and I don't feel good, you could say, oh, I could be doing something else. I should go do something else. So just having a little check-in once in a while, what else? So, future research, we are currently funded to look at screen use in cardiovascular disease, mental illness, including eating disorders. But, the goal is really to try to promote this evidence base to really impact guidelines and policy, especially with social media and adolescents, which there are currently gaps on. I had mentioned that the grant that we had put in as part of the Camera Act that was funded was specifically on social media and binge eating disorder, but we are also looking at substance use and depression, anxiety as well in future grant applications. And so our overall goal is to use these data from the ABCD study to really inform individualized guidance for specific adolescent age groups, specific modalities and platforms. And so with that, I just would like to thank everyone, especially those who, I'm here giving the talk, but there are many people in here who've really contributed a lot to this research. And so particularly staff, postdoctoral fellows. Jacqueline Herr is actually an undergraduate who designs all the infographics on these slides. So those are not my design, those are hers. And many medical students, graduate students, undergraduate and high school students, many of whom are here. And as Sandrine mentioned, we have a new cohort of students who have just started this week who are here. So welcome to all of you, and thank you for all the work that you will do this summer. A number of mentors and collaborators at, first at SRI International. I mentioned the ABCD study PI for Northern California, Fiona Baker is here, as well as Orsley Kiss. we have other international collaborators, and within adolescent medicine, thanks to Charlie and Sarah and many other people who are here, and other collaborators at EpiBiostats and the communications office, Jess Berthold, and a number of funders. So with that, I'm happy to take a few questions.
Oh, great, Jason. Very, very good. So here's my question. We hear all the time, steady drumbeat about how horrible social media and screen time is, especially for children. It's a 5-alarm fire, and that it's an emergency, it's destroying our kids. And it kind of feels, is the takeaway from your data that although there do appear to be some potential adverse effects, it's not really all that severe in most cases. Is that basically the message?
Yeah, I think at a population level, with the prospective data, we did find linkages, but they're very weak linkages. And so I would say it's by far from being like deterministic. It's not like if you're on a screen, you're definitely going to get depression, you're definitely going to get anxiety. Perhaps, and with any of these conditions, there's very complex multifactorial etiologies. And so perhaps if somebody is genetically predisposed, there are other things going on in their life, screen use, particularly social media use, and perhaps certain content, if it's bullying content or problematic use, maybe that can tip some of these kids over. But yeah, for the general population of healthy adolescents, probably pretty weak effect sizes. But I do think that, it differs for people. I think, as I mentioned, how I first got into this area, I think was sort of the extreme case with our inpatient population of eating disorders. There are certainly cases where I think, it really has been a big factor at the individual level in their disease illness. And, when people are posting content from their hospital room and sharing disordered eating stuff with the people in the hospital beds around them, that's a problem and we have to stop it. So that's sort of the extreme, but, for the most part at the population level.
In certain specific settings, it can be, but broadly, the message we've been getting from the media, social media, is this is a crisis, and it sounds like your data would really not support that. And I'm just wondering how. It doesn't seem like that message has really gotten out to the.
Yeah, I think that's a really great question. And I will say that, with the data that we have, I think, our best estimate is there may be some linkages, they're kind of weak, but yeah, it's not really causal for sure. And I do think that, the media, like social media, has some publication bias, and I think they're more likely to cover things that are, the splashy findings. And so those might be covered more. But I do think that, as I mentioned, we don't really truly know, because really even though this is probably a lot of the best data that we have in the US, it's really mincemeat compared to actually the data that the companies have. And so I do think that having more access to real-time data and objective data would help us to understand that better.
But I'm going to actually challenge our department chair on this a little bit, because there's the population data, right? But you also showed this dramatic peak during the pandemic that it still was before there and then after. And then you showed the 20, 30-year data of, people who were TV watching and what that did over 30 years. So if I just put those two together, I'm not so optimistic that in 20 years we still think that this was just a minor thing. That's one thing. And secondly, I think any suicide by a teenage boy or girl that can be linked to social media use is, to me, a preventable suicide. So I'm not sure if you need to see population level data to look at some of the data that you say, and saying it is problematic, maybe not so problematic as we should ban it all, but we really should think closely on how we can use social media more responsibly to avoid those, even if it's only a handful.
Yeah. Thank you.
But I do have another question.
Yeah.
I don't know if you asked that in your study, because one of the things that I think is not necessarily directly quantifiable with depression data and all of those outcomes is this idea of actually doxing and other maybe less extreme consequences of social media use, and there's a lot of subtle ones, right? If you post certain things on Facebook or on Instagram, does your future employer or the school that you apply to actually have access to that? And they're not allowed to, but they do, et cetera, et cetera. To what degree did the adolescents in your study, if you looked at this, were they aware of these negative consequences?
Yeah, that's a really great question. Unfortunately, we don't have that type of data in this study yet, although there are subsequent years, so it's something to consider, especially as they enter young adulthood. So we're kind of limited to the measures that I had, but I do think that we didn't really talk about education, cognition, and I do think that that's a whole nother area in which there are potentially many benefits for screens and education. There are also many limitations as we saw during the pandemic, but I think the evidence is also still out with that. And yeah, certainly, I think anecdotally, I've heard stories, even with like residency selection, people are very careful about what they post publicly, because of some of these potential adverse consequences. But I don't know that's been studied rigorously, but I do think that that is a important point about potential consequences of posting.
Thank you for your talk. It was really interesting. I was wondering if there was. I was wondering if he did any controlling for third factors that could simultaneously influence screen time and negative health outcomes. Like for instance, a child doesn't have a lot of, for instance, like the picture that comes to mind when I think of like a kid who watches a lot of television in the 80s is, a kid who takes the bus home and eats a TV dinner because their parents are working. And so that's poor diet and screen time, but it's not caused by the screen.
Yeah, I think that's a really great question with these observational studies because they're not trials. We try to adjust for as many confounders as we can. So I didn't really go into the details, but in all these analyses, we do try to think about causal diagrams and adjust for or control for factors that could be causal to both screen use and the outcome. And we have many of them in the ABCD study, but we don't have all of them. So that's definitely a limitation. For all these analyses, we generally control for socioeconomic factors like income, parent education, race, ethnicity, sex, age, and a few other demographic factors. And then based on each individual thing, for instance, we do control for baseline depression, anxiety, whatever. So it's not so that, they didn't have that before the study started. We control for that. So that's why I kind of said new onsets. But yeah, certainly there are parenting factors, there are genetic factors, there are many other factors we sometimes control for if we're able to, but yeah, certainly that's a possibility. It's a good point.
Thank you very much. This was great.